Hello, my name is Promise Sohiri. I'm a fourth-year pharmacy student at Ben and Métis Fish College of Pharmacy at the University of Texas at Tyler, and I'm going to be talking to you about the medication Tretinoin today. It does have different brand names that it's been referred to, depending on what it's being used for. It can be called Renova or Retin-A or Trelin, depending on what it's being used for. So brief information on the background of this medication. So it is classified as an anti-acne agent or as an anti-neoplastic agent when it's being used orally. But its anti-acne aspect of it is when it's being used as a topical anti-acne medication. So we also call it a topical retinol, and it's a derivative of vitamin A. And basically, this medication works by stimulating your cells or stimulating cell division, which increases cell turnover and also eliminates blackheads and whiteheads that causes the rough texture that you experience with your skin when you do have acne or pimples. So what is this medication used for? Like I said previously, it's used to treat acne, and it can also be used to control wrinkles and hyperpigmentation post-acne. So the discoloration you do experience after the acne has been treated or is gone away or the pimple has healed, it can be used to control that hyperpigmentation after the acne has healed or resolved, and also used to resolve uneven skin textures. So what should you tell your doctor before you use this medication? You want to tell your doctor about any allergies you have, or if you have experienced any allergies related to this medication, if you've tried using it before, or any component of this medication. Something to watch out for is if you have fish allergy. The medication Altreno gel, which is also tretinoin, but in its gel form, contains a soluble fish protein. So if you are allergic to fish or any type of seafood, you probably want to let your doctor know. So they might not actually recommend Altreno for you. They might recommend its cream, the cream form of this medication. Also, if you've experienced any sort of hypersensitivity to this medication or other retinoids, you want to let your doctor know, and also tell your doctor if you're taking any other prescription medications, OTC medications, any herbal products or vitamins. It's important to know all this information for them to be able to prescribe the right medication for you. And also tell your doctor if you're taking any medications that will make your skin a little bit more sensitive to sunlight. It's important because this medication has a tendency of causing your skin to be a little bit more sensitive to sunlight. And if you have a current sunburn or if you're currently pregnant, do let your doctor know this information. Also, so how do you take this medication? You always want to follow the instructions that have been provided to you by your doctor or on your label in the prescription. First of all, before you start using this medication, you want to make sure your hands are clean. So you want to wash your hands before and after you use this medication. So wash your hands first, and then you also want to wash or clean the affected area. For example, if it's your face, that is where your problem area is. So you want to make sure that you clean your face with a mild soap and pat it dry, and then you can put a thing or pea-sized amount of this medication onto your palm and spread it across your face or at the affected area and just rub it in gently, and then you can follow up with a mild moisturizer. And we do recommend every patient that is using tretinoin to wear sunscreen in the morning before they leave the house, and actually always reapply sunscreen as much as you can, because tretinoin has a tendency of making your skin more sensitive to sunlight, which can lead to some discoloration for some people. So how do you use this medication with wrinkles? If wrinkles is your issue, so you want to make sure that you wash your hands and your face before you put this medication on, and you don't want to wash your face for at least 1 hour after you've put this medication on. So we sometimes recommend that patients use the medication at nighttime instead of during the daytime, so that way they don't have to wash your face again before they leave the house. So you do want to keep in mind that, this medication will make your skin a little bit more sensitive to the sunlight. So it's important that maybe you probably want to use it at night over during the day before you leave the house. And also, we don't recommend that you put on makeup at least 1 hour after applying this medication, which is why we would recommend you to wear it at night over daytime. And always follow your skin up with a sunscreen before you leave the house during the day. So some cautionary things you want to actually watch out for while you're using this medication. The gel product of this medication has a tendency to be flammable, so you want to remove it from any areas that can actually cause this medication to light up or catch flame. Also, you want to use this medication on your skin only. So if it does come in contact with your eye, your nose, or your mouth, you can quickly rinse it off or wash it off with water. And if you experience any other side effects after this medication has come in contact with your eye, your nose, or your mouth, you really want to call 911 and go to the emergency room so they can make sure that you're okay. Also, if you're pregnant or planning to be pregnant, or you're breastfeeding, we do not recommend this medication for you. It's not recommended because this medication does have some side effects that it could cause or harm the child. So we don't recommend this medication for pregnant women. And some other side effects you probably want to watch out for while you're taking this medication. So you want to keep an eye out for burning or stinging after you've applied the medication. It could mean that your skin is a little too sensitive for this medication, or maybe the strength you're using is way too high for you. They might want to taper you down to a lower strength and then work your way back up. Also, a feeling of warmth. If you start noticing your skin is changing color after you start using this medication, you probably want to reach out to your doctor and just let them know, just to make sure that there's nothing more serious going on, or maybe the medication is just not right for you. And then some other skin reactions that you might notice while you start using this medication is drier skin, redness, swelling, or blisters, and pilling. That could mean that maybe the medication is just not right for you. You're using a way too high of a strength, or they might have to reevaluate your condition for you to be able to use this medication. And more serious side effects could be hives, swelling of the face, your hands, swelling and tingling of your mouth. That could mean a little bit more of a serious thing. So you probably want to hold on a bit, reach out to your doctor or your pharmacist, or call 911. And then if they determine that it's not a serious thing, then you might continue using your medication. If it's more serious, it's at least better that you know that, this medication is actually not for you, and maybe you might want to try something else, another alternative in the market. And in terms of missed doses, so if you miss or skip a dose, we do recommend that you go ahead and skip that missed dose and just go ahead and put the medication and just continue to use the medication in the normal, with the normal directions that have been provided to you. We don't recommend that you use 2 doses at a time, or we don't recommend that you use it in the morning and then at nighttime. Usually they recommend patients to use this once a day instead of 2 or 3 times a day. And then for storage, you want to store this at room temperature and protect it away from light, especially from the gel forms of it. You want to keep it in at room temperature in a warm, dry area. Do not freeze it or keep it in a very cold, very low temperatures. It's not recommended. But this is all I have for you today in terms of this medication Tretinoin. If you do have more questions, you can reach out to your physician. If you think this medication can help you, you can call your physician or reach out to your pharmacy, your local pharmacy, and ask for more information on this drug. But that's all I have for you today. Have a good day. Thank you.